Hello and welcome. Today's topic is our development of the oral cavity along with the teeth. So how our oral cavity forms, you have to understand. So first of all, ectoderm from the stomotium and endoderm of the cephalic part of the foregut. These two structure our overall oral cavity forms. Okay. Now this ectoderm of the stomotium, it forms the primitive mouth, which is also known as oral cavity, and endoderm of the cephalic part of the foregut, it forms the definitive oral cavity. Okay. Now for your extra knowledge point, you have to understand that in my earlier videos I told you that from the stomotium we are getting the nasal part as well as the oral part. From the nasal part, ultimately it forms the mucus layer of the nasal cavity, nasal septum and palate. So this palate I already talked about in my earlier videos, you can check those. And from the oral part we are getting the cheek, lips, gums and enamel. Okay. Now the main thing is at around 4th week of intrauterine life or intrauterine period, what happens? Buccopharyngeal membrane ruptures. Now due to the rupture, this ectoderm and endoderm combines together. Okay. After a few days, floor of the oral cavity forms. Okay. Now what happens? Both sided we have the mandibular process, right side, left side. Now in between these mandibular process, our tongue also develops, which I will talk about later. Due to the formation of the tongue or the developing tongue, it separates from the mandibular process from each side via linguogingival sulcus. Okay. Now this entire process occurs in the endodermal zone. Lateral part of this linguogingival sulcus, another sulcus forms, which is also known as labiogingival sulcus. This entire process occurs in ectodermal zone. Okay. Now the area in between the linguogingival sulcus and labiogingival sulcus, both part elevates and forms jaw and teeth. As I said, from the oral part, our cheek, lips also appear. Lips means upper lip, lower lip. Okay. Now in this process, what happens? This upper lip also gets separated from the alveolar process due to the labiogingival furrow. Okay. And we get the ultimately opening to the oral cavity. Now you have to understand the overall development of the teeth. So in MBBS part, teeth is not important in first year, but it is important in your second year forensic subject. Also it is important in your surgery subject 4th year, and it is extremely important for the BDS students. So if any dentistry students are watching this video, it will be helpful for you. Okay. Now our human body has two sets of teeth. One set in the lower jaw, another set in the upper jaw. Initially we have our deciduous teeth or the milk teeth in our babies and childhood, and after a few years we getting the permanent teeth. After fall of milk teeth, we are getting the successional permanent teeth. These are incisor, canine, premolars and one set molar in each side, upper jaw, lower jaw. Okay. And after a few years we are getting supra-added, which are extra molar teeth. Okay. Anyway, we'll talk about later. Overall teeth develops from the surface ectoderm, which ultimately forms the enamel part of the teeth, and surrounding mesoderm, it forms the dentine part, pulp, cementum and periodontal ligament. So how it forms? Step by step. The first step, at around 6th week of intrauterine life, ectodermal epithelium in the developing alveolar process area, it thickens and forms dental lamina. Now these dental lamina forms tooth buds in 10 places in lower jaw and 10 places in the upper jaw, and it grows, this dental lamina grows towards the underlying mesoderm. In the 8th week, enamel forms, and in the 10th week, enamel gets cap shaped. Okay. Now 5th step is our underlying mesoderm connects with the surrounding mesenchymal cells and face towards the enamel. Now this cap shaped enamel and this underlying mesoderm connects together and forms dental papilla. Now this dental papilla, within few weeks it converts into ameloblast. Now this ameloblast ultimately forms the permanent enamel. Now 6th step is, from the dental papilla we also get odontoblast cells, which later converts into dentine. Now what happens? After formation of the permanent enamel, at around 11th to 12th week, this outer epithelium, reticulum layer and the ameloblast disappears and leave behind the dental cuticle, which is also known as cuticle of Naismith. It's basically a thin layer. Anyway, now next what happens? Odontoblast cells also continuously regress, and it creates a narrow pulp area or pulp-like canal inside the dentine. and this gap area ultimately fills by the blood vessels and the nerves. Okay, this happens around the 12th week. The mesenchymal cells covers the root, which later modifies into cementoblast. Now this cementoblast cells forms the cementum at around birth. After formation of the cementum, surrounding mesenchymal cells also covers it, and these later converts into periodontal ligament. Now this ligament attaches or holds the root of the teeth or root of the tooth along with the mandible in the lower jaw and the maxilla in the upper jaw. Okay. Now what happens after a few months of the birth? Milk tooth erupts. Okay. And in between 7 to 15 years of age, all the milk tooth falls due to the eruption of the permanent tooth along with the 4 molar tooth. Okay. 1 molar tooth in the right side, left side, lower jaw. Another set of molar tooth in the right side, left side, upper jaw. Okay. At around 25 to 50 years of age, in the right side, 2 extra molar tooth, in the left side 2 extra molar tooth erupts in the lower jaw. Same to same, 2 molar tooth and 2 molar tooth in the right side, left side erupts in the upper jaw. So we are getting the extra 8 molar tooths. Anyway, all the details I will talk about in the forensic and surgery subject. So see you soon in my next video. Till then, bye.